Good evening, everyone. Namaste. Welcome to the 10th webcast session, which is in collaboration with Apollo Hospitals, and this is Dr. Srinidhi Chidambaram. Under the Apollo Hospitals webcast collaboration, you know that we have been looking at health not just as an afterthought, but as strategic capital. Mental well being is not separate from physical health, and it is also not separate from leadership performance. It influences your clarity, your resilience, your emotional regulation, and decision stamina. So, today's conversation is deeply relevant for each one of you because women who lead often are expected to sustain performance across multiple worlds simultaneously: enterprise, teams, family, and self. Women entrepreneurs often continue to operate despite repeated volatility, stress, caregiving demands, and performance expectations, often without a pause. Over time, this does affect your physical health, exhausts the body, and ultimately it also impacts your mental health, your decisions, your clarity, your emotional regulation, and everything else as well. And also, today we come across numerous terms to describe how we feel. It could be stress, anxiety, depression, burnout, all kinds of things. But what do they actually mean in clinical terms? Where does everyday pressure, everyday hassles transition into chronic stress? When do you need to take help? How do high functioning women still learn to mask some of these mental health symptoms? And how does one recognize these red flags? So, there are so many questions related to mental health, but let us remember today that mental health is as important as physical health. It carries no stigma, and it is something that is very important for sustainable leadership, just as much as financial and operational strength. So, to give us such valuable insights on mental health issues and to answer all your questions, I'm very delighted and honored to welcome Dr. Hema Tharoor, who is Senior Consultant Psychiatrist at Apollo Spectra Hospitals, Chennai. Dr. Hema, welcome. Thank you so much for being here, and I'm delighted to introduce you to our audience. Dr. Hema Tharoor is a senior consultant and has over 25 years of experience in the field of psychiatry. She's received the Dr. TMA Pai Gold Medal for Excellence in Medical Research and has completed the NIH Fogarty Postdoctoral Fellowship in ADHD at Washington School of Medicine. She's contributed several papers and has also received awards such as the Dhruv Kumar Award for the Best Paper in Psychotherapy twice in a row, and served as a faculty in charge of DNB training at SCARF and at several other hospitals. Over 50 quality publications in international and national indexed journals, co-authored several chapters in books in psychiatry as well. Thank you, Dr. Hema, for joining us today. And let me begin by asking you, of course, I will set the tone by a couple of questions, and then we will also come to the questions which you all have already been asking and posting on the chat, and there will be more coming as we progress in the session as well, which we will address. But let's begin by talking about these words that we now hear and read about so often, bandy about too, without maybe understanding what it really means. So we have chronic stress, we have chronic fatigue, we have anxiety, burnout, depression. Sometimes we use them interchangeably as well. So from a clinical perspective, how are these actually different? And, particularly for our women leaders on this call today, what should they be really looking at?
Uh, at the outset, thank you very much, Web, for this opportunity. And it's a pleasure interacting with you, Dr. Srinidhi. So I'll start batting immediately and sort of get into the topic straight away. Stress, as we all know, like you said, it's loosely used, but as a clinical explanation, it's like a physiological response you would feel. It can be acute or chronic, depending on the situation you're in. And I'll explain in a bit, and I think to tell you all how specifically you can delineate. Anxiety, for example, you need not have a stress. You could be, depending on the individual you are, you could be worried about your work. You could be a perfectionist. So you could just worry without a stress. You could constantly be ruminating and thinking, or there can be an external stressor that's causing you anxiety, in which the symptoms can be palpitations like a panic attack, fear. You may avoid meetings. You could present like that. Depression is a clearly, I know depression is loosely used, but depression, when they come to, like, for example, when you approach an expert like me, you clearly have 2 weeks of starting from sleep disturbances. Emotionally, you feel very flat. You're not interested. You are no longer creative in your workspace. You're not able to think strategically. You feel a lot of fatigue midday. And you may some women do report that they start crying without any reason, and then there's a huge hormonal influence also. So all this amounts to depression lasting for 2 weeks. Burnout is a very, very important, can be just exhaustion from work. You could be a high performing person not recognizing burnout and looking at output as a success, so you don't realize how fatigued you are. And it can also come from chronically being very, you have high standards for yourself, so you don't recognize, you're just pushing yourself in spite of being fatigued, and you're completely exhausted. And it can manifest just as physical symptoms, just tired the whole day. You don't have any of these symptoms I talked about. Yeah.
So you touched briefly upon highly busy and senior professionals, often high functioning, high delivering ones, who continue to keep delivering results, who keep showing up, but then they just start feeling depleted internally. So at what point do you think that, what are some of the earliest signs that one should pick up? Because instead of just, I mean, like, it's one thing to be tired at the end of a long day, but what are the signs that women must observe?
So, like, as a takeaway point for women listening to this, if your typical day, if you're sort of taking longer time to come to a decision, not just procrastination, but so remember, leadership is all about how you can regulate your cognitive energy, and you need to take that rest. Rest is a must. Or, like, if I can compare all you women entrepreneurs to elite athletes, where they say rest is important, recovery is important. So in high performing individuals, where even on a weekend you're somehow trying to, you sort of include work, you're not able to prioritize a break. Like I talked about emotional flatness a minute ago, you're just, you may not recognize workaholism. You're addicted to work. You can't think of anything but work. And you will tell yourself you're very, very busy, but you find yourself, so that kind of tiredness, no, you hear it's about, especially for women, it's about, I don't think there's a balance, it's dynamic. You balance work and relational overload in the best possible way. So you'll hear yourself feeling very, you will feel the fatigue. You're not able to make a decision. You're not strategizing or finishing a task as fast as you would do earlier. And you just feel, I mean, one common thing that we have noticed behaviorally in the last few years is a lot of use of stimulants like caffeine at work, because you're just feeling, I mean, as a indicator, I'm saying you could love coffee, but just to stay awake or stay sharp, if I can mention like that, and feeling very internally depleted. That's why a lot of women, when they meet me, they say that I'm high functioning, I got the promotion, I did everything, but I just feel hollow inside. So these are very clear indicators.
Right. Uh, Dr. Hema, I think, we have received quite a few questions from the audience. So I'm going to intersperse our conversation because I don't want to end up with no time for those because those are the actual questions. So let me first begin with this question. There's a belief that entrepreneurs need to be strong and they need to be almost masculine. How much of awareness, acceptance is there among professionals about emotional well-being? And I think I want to add that to be meaning that, sometimes even more than women who are professionals, I think when you're an entrepreneur, you probably are competing in a world which is very competitive, very aggressive. So, is there any room at all to admit any sort of weakness?
No, I think that's a perfect question here. I think over the years, even now as we are discussing this, I feel there is a lot of awareness. But if there was a scale for acceptance, uh, a lot of time that's still in lagging, So for them to even, because to accept when you're at the top that a struggle could equate to weakness, meeting me or going for therapy could mean failure in their head, because there is all this whole, like you rightly said, a macho driven societal kind of perception about men on top versus women on top. So when you are in a leadership role, I think what is very, very important as a takeaway is most sustainable leaders are self aware. So the more awareness, much better. Earlier, it was all about being stoic, being, you perform a certain role. But now with women taking over, while there's a lot of talk about work-life balance and everything, I think this real gender difference, rest means you're perceived as lazy. So there are a lot of myths that need to be broken.
A little bit about the brain are operating under these conditions. So, could you explain to us what exactly happens? We can start off as anything like, some exhaustion or anything that is disturbing it. What exactly happens to the brain? How does the wiring change? How does it affect your everyday life?
Thank you for bringing that up. So if we could look at your forehead as the prefrontal cortex, that's the CEO, that's the leader that sort of is important to regulate attention, memory, emotion, response inhibition. And there is an area called the amygdala, which is in a, the area being hippocampus. That person is sort of regulates your threat circuitry. It sort of perceives threat. So many a times when you start feeling exhausted and you're tired, your cortisol levels can go up because the threat circuitry is saying, hey, now we have to be in fight or flight mode. So the amygdala becomes overactive. The prefrontal then becomes very in a shutdown mode because they're, so when one goes hyper, one sort of, depending on the amount of stress, depending on the cortisol, there is a feedback in which the prefrontal, it's like prefrontal puts your brake, the CEO puts the brake to the threat. But it's like as if the CEO is sleeping, driving the brain sleeping. So it doesn't put the brake. And then we are all into, depending on the individual hormonal age, you can have a flurry of symptoms ranging from anxiety to depression to exhaustion, like we talked about. So if as a takeaway, if people can remember the threat center and the CEO center, if they work in tandem, you are very self-regulated. But when one is on an overdrive, then you get a lot of these symptoms.
Okay, so here's another very commonly felt issue where women leaders are also expected to carry a lot of emotional responsibility towards sometimes their teams, but definitely their families as well. And many times it expands across generations. So there are aging parents, there are teenage children, the husband, the home, many things like that, plus the work pressures. So we now talk a lot about boundaries. So I think the boundary is another thing which people talk about a lot. I mean, there are many, many articles everywhere on the internet about it. But what does it really mean to set boundaries? Where, I mean, I know it's a kind of quite a long topic, but setting boundaries also does it have any role to play in improving your mental health?
Oh, absolutely. So when you have generally, if you have a porous boundary, like we call it, you could be a leader, but you could tend to, like I just, when I started this Q&A, we were discussing about, you could worry about being on top of the job, not doing enough, your own standards. So you may tend to be join in meetings which you don't have to be in, you don't know how to delegate, if I can put it like that. So boundary at work means while you lead, it's more of time management is equivalent to energy management. So you're managing your energy, so you keep a boundary, you don't have to be there in every meeting if possible, so you do that. Then I think a lot of time, while many women try and do a very collaborative approach and not sort of portray themselves as they're controlling the situation, but sometimes again there it gets blurred, where it a lot of times emotionally auditing the situation, trying to sort of instead of strategizing or going into fixing the problem, there can be an emotional boundaries being crossed, um, while you maintain a healthy working relationship with your subordinates, and you can end up being a little enmeshed in the relationship, and bring in sort of, then you start worrying whether uh, so we call it as identity fusion, like you don't know how to and your personal thing gets involved, you start personalizing that you have to fix every other thing involved with the employee. So 100% boundaries, while you can have, instead of firm boundaries, porous, but ensure there is also a line drawn.
Here's a question. There are quite a few coming on the live chat as well. I'm going to come to them in just a bit. Sorry, they're all, I mean, I'm just going to take them as they come because they don't follow a particular theme or anything, but I think it's important to address questions. So here is one. We were conditioned always to be good girls since childhood. This conditioning often makes us feel overwhelmed while we are balancing the family and the business. So, how to be at peace, choosing work over family sometimes when it is very important for building a business to grow and upscale?
Nice. I think that this identity conflict has always existed over generations, and it's not because I think women, we are conditioned to prioritize harmony and caregiving, and when you're a businesswoman and an entrepreneur, that demands priority, and then you end up feeling very guilty of devoting time to the business. So how do you get peace is, uh, in fact, we in psychology we call it seasonal prioritizing. If the business demands, yeah, you may argue back saying, oh, it demands my attention 24/7, but that's where clear communication with the family, this shifting from either or work or family doesn't work with women. I think we'll all collectively agree we need to do the balance it, even though it's dynamic, balance it in such a way that everybody around us will not be happy, but we try to get peace by that communication, recognizing also that there's a huge financial growth that supports the family because you are putting in all this effort. And if I can be I know a lot of people will say, oh no, but we like to be perfect, but letting go of little perfection, like saying that I have to do both roles very perfectly, and that creates a lot of anxiety because your standards, which I said, perfectionism internally causes a lot of um, unnecessary worry. So you're allowed to be ambitious without an apology, if I can say that. Be ambitious and not apologetic.
Okay, so here's Shreya asking about another very well spoken about topic all over the place now, really. So, this is that whole gut brain axis and how it really affects the mental health. So, that's her question.
So gut is considered as the second brain now. Gut has a lot of, so there is this whole polyvagal. There's a vagus nerve, which is the longest nerve, and it sort of dies in your stomach. So if all of us are well known to, we've all had some tension, diarrhea before exams. We have had constipation. So if you look at anxiety, can have these physical symptoms, and that's because there is the whole, for want, the easiest chemical to remember is serotonin. So there is the intestinal serotonin also that plays a big role in maintaining uh, your, and in fact your mental well-being. And now there's a huge in science, in psychology, psychiatry, science looking at psychoneuroimmunology involving the gut microbiome. So the entire gut is lined by microorganisms which help in the gut brain. We call it the gut brain dysbiosis. So a lot of times, like even conditions like irritable bowel syndrome, is all about sort of regulating the gut, so that and in anxiety or depression, the gut can go kaput, if I can say. So it's very important that you treat the gut.
Kanak here is saying that I've had nausea and headache. Um, Sorry, I've had nausea and headache for 1 year. The MRI is normal. Doctors say it's because of stress and anxiety. Can anxiety do this actually? Don't want to take medication as such.
Yes, 100%. So one is to probably, even if you've, let's say, fixed your lifestyle in terms of eating right, you've taken care of your diet, but many a times if there is an ongoing stress, it can present as a chronic headache. And very psychologically we say that chronic pain and nausea, in fact, it comes under the rubric of psychosomatic symptoms. You having bodily symptoms, but let's say everything else is ruled out. You are expressing your stress through these symptoms. Like I talked about cortisol, and I talked about, so these can, once cortisol goes up, you can, ranging from headache to nausea to other physical manifestations you can present with. So if you could get external support, meet a therapist and start a very qualified therapist, I would correct myself, and make sure that these symptoms are explored, I'm sure you will feel better, much better.
As you spoke about qualified therapist, Dr. Hema, I think I just wanted to bring up to our readers also, to our viewers also, this current trend of a lot of, I know that we use AI for a lot of things, but I just wanted to add that there is a lot of research being done now that you should not really rely upon chat GPT and things like that for your mental health concerns, because there have been instances of it not quite getting or giving you the right advice. So I don't know if you'll agree with me, Dr. Hema, but maybe that's something which our viewers ought to know.
Yes, because I think now we are seeing a big boom in people going into, AI driven advice.
Yeah,
But it'll always be better to sort of check with your qualified expert and a professional outside. And
correct.
I'll also admit that nowadays the maybe the go-to is the AI sometimes, and AI refers them. AI says go meet the psychiatrist, and
Yeah,
nowadays
I know.
regular referrals from AI also.
That's good. There are a couple of questions, Dr. Hema, about again other colleagues here feeling nervous. So there is somebody who says that at every news change, I feel anxious. And there's another talking about prior to meetings, a little bit of shivery feeling, and the voice quavers, and it's visible. So what am I scared about? And another one also about, can I take anything to calm my nerves before a meeting so that I can perform a pitch better. So I think these are kind of all groupable into some sort of performance anxiety or what, I don't know. So could we take them all together?
Sure. So one is generally like this: meetings, anxiety in specific situation. You'll usually have a story behind it. Even it could be in school. It could. I'm talking about. I know the query was posted here. It stage fear. It can come, or even in classroom, and the teacher would have asked a question. You know the answer, but the fear of being ridiculed. Will you make a wrong mistake? These things would have, in some people, there is a childhood story to it. Now all this put together, everything that people have raised here can be addressed through, there's a specific therapy called cognitive behavior therapy. Like if you can find a cognitive behavior therapist and undergo a few sessions, 100% the fear would go away. Now if you are somebody who's there's no time for therapy, and so you need to consult somebody like me, like a psychiatrist, who would give you something for that occasion, like which you can take to. Somebody was asking this: is there anything to calm my nerves? So this calming your nerves is basically sympathetic overdrive. You've prepared for the meeting, you're going into the meeting, you're anticipating. So what I just told you, your CEO, your fellow in front here forgets to put the brake. The amygdala and your brain is saying, oh my God, and catastrophizing. Then there is a lot of sympathetic overactivity. So you could feel palpitations, you've prepared, and you'll have panic attack, your voice may quiver, you may feel shaky. So there's a medicine to give you. The other very nice thing that all of you who have this anxiety is you could practice any form of box breathing. It's a 2 minute. You inhale, deeply through, like, take 2 breaths in a minute, and then take a deep exhale out and bring in a visualization. You visualize, definitely shouldn't be parents, your loved one, God. It should be a neutral imagery that makes you calm. So these are small 1 minute tips to calm yourself, but I'm sure all this is not just one-off thing. There would be a story behind it. So kindly meet a therapist, a professional psychiatrist, psychologist, depending on your needs. Definitely it's solvable.
The thing about a lot of these questions is I think a lot of us identify with many of these things. So here's the next one where, this is about how we tend to replay conversations and decisions in our head at night and, overthink things all the time. So here are some people asking about what this is. Why is this happening? Is it like, replaying every action after doing it and, like trying to replay conversations? I think it's that whole worrying thing that happens.
So, see, all of us think uniformly, I mean, unanimously. Some of us worry, some of us obsessively worry, and that's when it's called rumination. And many a times that rumination can get into, because there is a dopamine high with that rumination, because you're thinking of all kinds of possibilities. Let's say you finished a meeting, you wish you had said this, said that, and then you're sort of imagining what else is possible, and that keeps it will give you a dopamine hit in thinking like that. So usually if you're suffering with constant procrastination and rumination, I always tell people who meet me, keep a worry time. So let's say you're ending the day, you're going home, you're worrying. You say, okay, I'll worry at 9 p.m. But 9 p.m. you're allowed to worry. You must keep only a 5 minute timeout. 5 minutes, look at your phone in selfie mode or at the mirror. And we call it as schedule the worry time, and that's it. And I know it's easier said than done, and then you're winding down routine to go to sleep, because otherwise this will affect sleep, and sleep is very important for all this subjects that we talked about. So schedule worry time. So the next day morning, if you're still thinking about this, you will say, oh no, 9 o'clock I'll worry. So by that, you're detaching yourself from that cognitive overload that you're giving yourself with worry. And I think I read this somewhere: don't allow rent-free thoughts in your brain. It's rent-free sitting in your brain, and you're done with the meeting and you're just going on and on and on. So do this.
One important question that I wanted to bring up is, this is one area where, there are some kind of not nobody is quite sure when you have to seek help, because one always, unlike a physical ailment which also many people push under the carpet till it becomes like something that's really intolerable, mental health is even worse, because there will be people around you, perhaps there will be people at home saying that oh, there are people who have it worse than you, and you're just, like, and then you have your doubt whether you're overplaying the whole thing, you're being dramatic, or, that you don't really have to seek help. But then sometimes you don't, but sometimes, there are these red flags, which might not even be in your case, but, you see your loved ones. So what would these, kind of, when would the breathing and the winding down and all not be enough? When is the time to really at least see your GP, even if you don't directly go and see a psychiatrist or
Yeah,
anything?
I think first indicator is definitely your circadian rhythm, which is sleep. Because, of course, there I will give a caveat. There are highly successful people who say we are short sleepers. So 4 hours of sleep, I've always slept only 4 hours and I function very well. So, but as age advances, there's lots of studies with short sleepers and higher risk for heart attacks and stroke. And so sleep is very, very important. If you're having fragmented sleep, meaning you go to sleep, you're waking up at 2 a.m., and then you're worrying about the work to be done, or what you did in a meeting, or that's being disruptive. Then very, very important is, like I said, for at least for a minimum period of 2 weeks is what we look at, where you have completely lost interest in what you want to do, be it your work, and you are not feeling the joy. Maybe you got a promotion, or even if you're supposed to perform, you're just so, from energy to energy depletion to, so it's both physical and psychologically, where you lost, we call it anhedonia, no interest in pleasurable activities. Appetite is affected. So we always say food, sleep, intimacy, all this being affected, it's affecting, you've become more withdrawn, quiet. We call it as being very emotionally withdrawn. All these are signs when you must meet. See, if your go-to is a family doctor, of course, we try and rule out thyroid and other hormonal conditions. But then, if it's very clearly psychological, please approach a psychiatrist ASAP.
Uh, there is another question too about exactly this, about the cycle and hormonal shifts. So when I feel irritable before my cycle or during such hormonal shifts, how much of that is biological versus should I take it as emotional stress?
Oh, 100% biological. So there is something called premenstrual symptoms. Then a lot of people have premenstrual dysphoria. And if you have every month, this is happening for at least a year, then we diagnose it as premenstrual dysphoric disorder. So there is easily about at least about 60 to 70% of women talk about PMS, premenstrual symptoms. The dysphoric disorder is as high as in the range of 30 to 40%. So it exists, it's treatable, it's completely biological. Nowadays, you have a lot of apps to sort of, in the sense you can track your menstrual mood change and everything. But a lot of time when women are trying to sort of, for want of a better word, multitask, uh, sometimes in the relational space, because you may react very irritably, your spouse is the one who gets it the most, or the children. And it depends on how well you sort of, how well you communicate. Okay, I've had people who say that you want to bow down to the uterus because the woman in the family is in a different mood altogether. So it's 100% biological, but it's very, very important that you communicate. And when it's severe, in fact, I liaise with a lot of gynecologists because there is a specific medicine they give, which is called YAS, which is a progesterone estrogen kind of combination that helps in this. And even we treat PMDD. So it's like a let's say it's a marriage between me and the gynecologist in treating this.
I suppose similarly, there's also this whole postpartum uh, depression and also the menopausal syndrome
Correct.
of.
So if you're looking at a woman entrepreneur, woman leader, or a business person who's across the lifespan, that's what a young person, postpartum blues and depression, very common. Then in your, again, please talk to somebody and talk to an expert. You can always tell your gynecologist and seek the right professional help. This whole myth of you need to be strong and you have to take care of the baby, and again, there's a huge cultural and generational shift now. So when you're looking up to your parents, they may find this new and they may say that, hey, no, we all gave birth, you're supposed to just grit it and bear it. Now the narrative is different. Please seek help. It's completely biological. Like this entire topic about the stress is neurological. I'm talking from the brain's perspective on how much of burnout and cognitive overload, and we are looking at how to conserve this in the most scientific way. So it's very, very important that we do this regulation across. And nowadays a lot of people have perimenopausal symptoms and postmenopausal, and just don't blindly trust what's on the internet, because Google can just go on, and now thanks to AI, if you feed in something, it depends on the prompt you give the AI, they will come up with some other responses and you could feel very overwhelmed. So it's always better to sort of, the hormonal imbalance exists, and your age is very, very important, the work you do is important, so kindly seek the professional at the right moment.
There's also this huge internet presence of supplements and alternative medicines that complementary medicines that kind of people advocate. So even in countries abroad, there are these huge health supplement things. So this right 5-HTP to lemon balm to lavender to all sorts of things, and of course ashwagandha was
Yes.
quite trendy. I don't know about now, but what is your take on all that? I mean, do you think it's, or is there any kind of home remedies for these kind of things at all? Because again, the internet and social media is full of these kind of things.
So while there is a general, let's say if I can call it a myth about, allopathy, like allopathy, you can Google, you see a lot of side effects, and if the side effects are put on the Google, then that can sort of, if you're somebody who worries and who's health conscious and anxious, you may want to stay, you will say, oh, I want to stay away from this and just do it all naturally. I'm saying it's a choice to take a fine balance between how to self-regulate physically and emotionally. So someone would recommend having your cinnamon tea, lemon tea, but two, like the hormonal treatment that I suggested. Two, if you're obese, metformin is suggested. It's an anti-diabetic drug, but it also helps with insulin resistance and PMS and PMDD. So the point here I want to make is care can be holistic. Most of the time in what Dr. Srinidhi was talking about, nutraceuticals as we call it, we do a shared decision making. If there is, we always, like if I can speak for myself, I tell them about the, if there is harm, or if sometimes I don't know about the nutraceutical, then I tell them I don't know whether this will work or this will not work, but please kindly ask the professional or the doctor you sort of go to, rather than just blindly trust what is online. Plus, see, now with all this running group, fitness group, and lot of quacks on WhatsApp and other social media platforms, the layman is confused. No, you will see a certain reel and think, oh, this person did it, I can do it, and there have been deaths also. So big advice is, as far as this whole nutraceutical is a $1 billion industry, please check the facts out before using it and consult a doctor.
There's also another question, doctor, that, like constantly being online or constantly, many of us have to be like, there is also tendency to scroll all the time and all that. So there is a lot of So most people post some version of themselves which is very, very aspirational, and it's full of success and the perfect life and that sort of thing. Do you think that, women also get quite, worked up because they think that, there are so many people being successful and all that. So how do you kind of normalize or kind of regulate these kind of things? Because it's inevitable that when you can only look at a lot of narratives online, you do end up feeling a bit, you have your own self-doubt, or you wonder where you are compared to these things. So do these things also affect the mental health?
Oh, 100%. Because so that's why we say like to cut down on screen time, which is, or digital detox and digital hygiene. I in fact, in a healthy way, because you're an entrepreneur who's forced to be online and you are exposed to screen time so much. So uh, cutting that down definitely helps, and keeping us like a schedule, regulating that helps. But to answer your question about when you so there is a lot of FOMO, like people say, fear of missing out, and you're so busy. So a lot of people, in fact, it's called revenge bedtime procrastination. You're so busy with your work, you don't have time, you don't know what's happening. So you end up, you eat into your sleep time, because that's the only time you have, because otherwise you're busy the whole day. And then you're doom scrolling, so you cut into your sleep time, then your sleep is reduced, or it's fragmented again. And then again, this whole vicious cycle of you haven't slept enough, haven't rested enough, and that will affect. So net, I think it's very, very important, all of us, to uh, have a digital detox, and
Yeah, possibly tell ourselves every day that what we
digital
see,
wellness, as I can call it.
yeah,
Yeah.
and what you see digitally is not really the real lived life of those people, also,
Very
perhaps.
true. Sometimes it is, like we all know, it could be, projected in a certain way for certain goals. So your self-worth, your output shouldn't be only if I have a certain output, then my self-worth is great. If you equate it to that you have to be productive. Instead, how you manage your energy management, how you prioritize your, like I would say, prioritize your brain. And if you prioritize your brain, your mental health, your mind is at peace. And how you can even strategy optimization, and whatever that you're doing, how do I strategize everything and juggle it, would be a success.
Here is Shreya again asking about coenzyme Q10 and magnesium. So, those are these supplements useful?
Yeah. So, Shreya, magnesium, there's no long term studies on magnesium. There's short term, where magnesium helps for sleep. Even this whole thing about magnesium helping in restless leg syndrome. Actually, if you have, if you just massage your calves with coconut oil and go to bed, that will do the same work as magnesium. So it's the massage that is helping and not the magnesium. But short term, magnesium is good. Long term, none of us know. As I'm speaking, we don't have long term effects of magnesium on the body. So all of us advise that continuously taking magnesium, and there are three different forms of magnesium. There are enough, I think Dr. Srindi just highlighted, enough influencers, uh, medical influencers, who will talk about magnesium's effects and how good it is. But as I speak, the verdict on long term use, none of us know. So I would say short term is fine. Coenzyme Q has become like if I can say, like Tirupati Laddu. Okay, everybody writes it because yes, it has a lot of antioxidants and multivitamins, and specifically helping with cognition and memory. Uh, so many a times when you have like between your normal B12 supplementation, at least B12 you can check. So this is like a nice cocktail of multiple nutraceuticals. For some, again, there is no harm in continuing coenzyme Q. You're getting an antioxidant supplementation. That is, but mostly we sort of, it's used after 40s. If you're very young, I wouldn't recommend that you just take coenzyme Q. Yes.
Here's someone asking, how do I stop saying yes to everything? Now, this is something which, many of us have a problem with because we don't know. We think that saying no, especially at work, somewhat puts you in some kind of, you're not a cooperative employee or you're not somebody who's willing to work for the organization. Kind of.
So that it's a problem because see, with no, the only issue with no is who are you saying no to, and if you are somebody who, for want of a better word, is a people pleaser. So this is coming from even your personality attribute. Very hard to say no. You always, even at home, this may not be just a job issue. You may even at home suppress, or if I can say, repress what you need because the other person's happiness counts more. And or you could also be confrontational avoidant. You don't want to say no and then get into an argument, or you see the displeasure in that person. Now if you are that person who is, like I said, a people pleaser, and you also worry about, if I say no, then it will, like, it'll affect my promotion, it'll affect, definitely. So for this, the only solution is, you must, like we talked about boundaries, and we talked about, so in the purview of your work, see, sometimes it is where you're expected to work beyond a certain time and it demands, and there is no proper work life balance. Let's say in certain situations, you definitely, it's important that you communicate that I'll finish the task, but I am clear it's difficult for me to attend the meetings if there are certain other commitments which are equal, but definitely, like I said, not at the cost of compromising task allocation. You can't keep juggling so many things and keep saying yes, yes, yes. Somewhere the buck has to stop, and you have to learn to say no. It is a hack to say, oh, I do it later. So it need not sound like no.
Here's another question. I'm having hallucinations. What can be the cause for it?
Hallucination means you're actually hearing something, mostly, uh, and if you're, I mean, if you're really saying hallucination, then sometimes if you've not slept properly, lack of sleep, somebody will say, when they're going to sleep, they hear something. When they're waking up, we call it, going to sleep is hypnagogic, waking up is hypnopompic, and it's perfectly normal. But if you're seriously having hallucinations, otherwise, you must consult a psychiatrist. We try and rule out, why are you having hallucinations. So it can range from substance use to, you could have a severe depression. There are certain conditions like severe depression, bipolar, psychosis, as we call it, where somebody starts hallucinating. So there are multiple reasons for this, and so it's very, very important that hallucination is serious. So please meet a specialist immediately, ASAP.
Can women have it all? Dealing with people outside is easier than dealing with the judgment of those around you. How does one handle and let go of toxicity in the house?
I mean, I think it's hard. I don't think yes and no. Women have it all in the sense, on paper, you can always say you have it all. But how you navigate that ship is very, very important. Communication is the key. It's okay to upset your significant other or children sometimes, because you need to prioritize. I think I just mentioned seasonal prioritizing. So you could be year end, but it could be your children's exams. Your children want you, and you're expected to be at work. So you'll need to talk to your spouse or your partner and say, listen, I need help. So it's about how well you communicate, even though it looks like we have it all. I think it's a huge task that we pull off. And I think it's very, very important how we are, you know, emotionally regulating it, self-regulating it. And I'm sort of paraphrasing the whole topic that we just discussed. And it also sort of, the more you're able to navigate it, the more resilient you feel that you're able to do it. And it's okay to take breaks. It's okay to say that, hey, I need a break and I can't do this. So communication being the key.
If you had one mental health rule for entrepreneurs, what would that be? And somebody also asking about just 3 daily micro habits to protect mental health.
Yeah, that would be, I think, okay, one big rule is, just as a takeaway would be, for leadership, I think 100% preserve your brain more than anything, and preserve cognitive overload, like to prevent where you don't end up being exhausted and drained end of the day. So while you're juggling everything, just make sure, even the greatest of leadership roles, to know when to take that break. So break means movement. So I think even if you're taking a meeting, after max about 60 minutes, 90 minutes, at least walk for 3 4 minutes, take a long walk and come and sit down. So the movement is very important. It's also very important. I know there's a lot of again vitamin D3, sunlight. If it's possible to have that kind of an exposure, and even if you're juggling, you reach home, and then if you can have a 10 15 minute walk, like movement at work, because you're sitting the whole day or you're doing meetings and you have to walk, but you also bring in some form of exercise that can, and it could be exercise, it could be, we call it me time, unwinding me time without work, without family, where it could be, when I say spiritual, if you are somebody who likes prayer, good. I mean, if you are just meditation, whatever suits you. Somebody likes swimming also, so if you think you can have you drive down to a place that you can have a swim and go back. I know women, we're all thinking dinner and everything, but so that unwinding post dinner, 1 15 minutes walk, if you can manage, so very, very important to do that.
Here, I must ask also about, we did touch upon addictions and substance use and abuse, because many times it is also seen as a way to switch off, way to unwind, way to relax. So, what would your views be about that? I mean, in the sense that, like using such crutches all the time sometimes is also, I mean, we know doesn't do much for your health.
So the biggest, I think, bane of substance use is, it could start from social drinking to and lead on to a harmful use. And then alcohol is a slow killer, slow poison. It affects the whole body. So you may realize you're cognitively, going down, and you're not as quick as before. So that's the biggest, uh, you know, sort of disadvantage of being hooked onto alcohol. Smoking, and a lot of people now smoke up, and are, claim to be very high functional. But now in the last 5 6 years, and after COVID, there's a lot of work on how cannabis affects the brain, affects cognition, it slows you down in the long term. You're not, there's something called amotivation syndrome, chronic amotivation syndromes. So while somebody can juggle substance use and be a high performer, between them versus someone who's not, so this is, I'm not talking about occasional use, I'm talking about regular use and harmful use. It's very, very important to keep in mind that using that as a crutch can then again affect sleep, again cause exhaustion. So substance induced mood disorder exists. So somebody, I think, asked about hallucination. Somebody asked about, I mean, when we were trying to start off the session with delineating depression, in a lot of high performing leaders, this is a hidden cause for the depression, where they're so, especially a lot of them, feel now they've reached the top, and sometimes there's a vacuum void, and then substance use sort of fills in that void, and then the depression could be secondary to that.
I just wanted to ask about, we spoke about toxic behavior at home, but today the toxic workplace is another area by itself. So, any tips to our women leaders on how to manage the toxic workplace? And then there's also much more than toxicity, isn't it? I mean, now we do have people speaking up about other kinds of abuse, sexual abuse, or there is not even abuse, but just inappropriateness. So, do you think that's kind of coming down now with more and more gender equality in the workplace? Or is it that as women ascend higher and higher, they have to kind of cope with this sort of thing as well?
Yes, so I think now the last 10 years, what I've seen is this a lot of gender sensitization, breaking the gender stereotype. I think it's mandatory now to have a sexual harassment committee. People are being educated about body shaming, fat shaming, and these comments which they would later on say they were just joking, quote unquote, uh, and not to get personal attacks or favors implied. And all this is being etiquette. If I can talk about corporate etiquette, where do's and don'ts, which can border on to sexual harassment. There are, in fact, training and awareness programs being done. But having said that, there is always that cheeky outlier person who will still can't tolerate that you are on the same role as this person, and you will still get that nonverbal comment or look or an expression, or it will be laced as, hey, it was just a joke. So it's very important to recognize it, address it, and call it out in a very dignified way, is what I would tell women here. Because I think if you keep silent, a lot of time it's taken also as, oh, you're okay with that kind of joke. So I'm not advocating here that sometimes some of it, it may be where they're discussing something and it's harmlessly said. When I said it's harmless, I'm saying most of the time we educate men, even when we do some corporate talks, we tell them to be now very mindful. Like today, in today's world where politically right, so it's very, very important to be aware of and mindful of your environment and speak. So it's your right to call it out. And if somebody is repeatedly harassing you, if I could use the word, I think you should sort of inform the HR. Don't hesitate. Don't worry about, oh my God, this person may lose his job. But if he's crossed the line, this is a clear boundary you make here, no porous boundaries, and straight away take it up with the HR.
I think we've covered almost a very wide range of topics, and I'm so glad that so many of them have said on chat that they wanted a longer session, they want more sessions, and they also want to talk about children's mental health, which I think, as they say, that as mothers, many of them would like to know more about. That's another very important area that's kind of concerning many women these days. But today, that's it for now. And I think I would like to close today's session by, first of all, thanking Dr. Hema Tharoor for patiently answering so many of these questions. And I would like to thank each one of you who posted these questions, because this is also a question that might be on other people's minds as well. So thanks for bringing it up and speaking up. But I think the takeaway message from this session is that, mental well-being is not something like a soft, fluffy topic. It's very, very crucial. It's vital. And I think it's actually one of the foundations of not only a happy and healthy life, but also your career, your leadership, everything. And this collaboration between Apollo Hospitals and WEP is only continuing to create safer and safer spaces. And I've been noticing that, after 10 sessions, we have been able to discuss topics that are closer and closer to your hearts. We usually take in your comments, your suggestions before we frame the next session. So thank you so much for helping us become a kind of a collective where, we are there for each other and women address issues together and solve issues together. So thank you so much. I'm glad this is becoming a forum where we can all pause, reflect, and prioritize our health. And I hope to do many more such wonderful sessions. Thank you, Dr. Hema. Thank you, everyone who joined us today. And thank you to the WebCares team and the Apollo team as well, who have played such an important role in getting this all together. Thank you and see you all soon. Namaste.
Thank you.